Welcome back and thank you for staying with Morning Express. We now want to have a discussion based on your health segment, and it's all to do with the Global Healthcare Summit that is supposed to be held between the 18th and the 20th of November. A lot is set to happen during that particular summit that is set to spark a global conversation on the healthcare of today and raise awareness on various health issues across the continent in terms of a multi-sector dimension. Now, one of the partners in terms of the side events, WaterAid, will be focusing on water, sanitation and hygiene in healthcare facilities, pandemic preparedness, as well as a response towards the pandemic. So we're set to have a discussion with WaterAid, specifically Annie Msosa, who's an advocacy advisor at the WaterAid Foundation. Thank you so much for your time, Annie, joining us from Lilongwe, Malawi. And we'd like to begin perhaps with your experience on why exactly it's important to have such a discussion on integrating water in the healthcare or hygiene services and healthcare facilities across the continent. Your take on that?
Thank you. So I think it's really, really important to integrate water, sanitation and hygiene in healthcare facilities. First of all, because healthcare workers need clean and safe environments for them to be able to deliver dignified and quality care to their patients. At the moment, this is a really, really big challenge in healthcare facilities because worldwide, 3 out in 10 people cannot wash their hands with soap and water. Within the healthcare space, 1 in 3 healthcare facilities do not have what they need for healthcare workers to be able to wash their hands for them to provide care. And 1 in 4 healthcare facilities have no water. Now, these are all things that we have seen that became really, really critical, especially right now when we were all suffering from the pandemic and trying to overcome it. And for us to be able to have, health systems that are strong, health systems that are able to protect the people that come to get services from there, health systems that can withstand future pandemics, it's really, really critical that they respond to the basics that are needed. For them to operate effectively and efficiently as well, and be able to protect their patients and control infections.
Okay, thanks for clarifying that. I understand there will be a launch of a Hygiene for Health campaign. Perhaps talk to us about it in terms of the aims it is set to achieve when it comes to ridding some of the sanitation and hygiene issues within the healthcare facilities in the continent.
Okay, so the Hygiene for Health campaign is really looking at the big challenge that is there world over in as far as ensuring that this hygiene is adequate within health services and even at home. It is looking at the big gap that is there, both at policy level, political commitment, the budgets that are there, and really taking action to make sure that we are meeting these basics for everyone. So what the campaign is trying to do is to accelerate action towards improving water, sanitation and hygiene in health service delivery, but also especially hygiene being available in people's homes and people being able to wash their hands and maintaining good hygiene so that we can all be able to achieve and have that public good, which is health, and health for everyone. So the campaign is just trying to accelerate action and bring people and governments and private sector together so that we can all talk of a different world where we are able to withstand pandemics and we have health services that deliver quality.
Okay, it seems to be a solution-based approach. Speaking of solutions, what exactly is a solution that you aim to achieve, especially on hygiene? And when we talk about pandemic preparedness and the response, because Africa has been called out perhaps by the other continents in terms of the preparedness and response. We've even, put ourselves on the spot when it comes to vaccine and whether we can produce them locally. Well, what's your take in terms of the solutions that should be achieved when we're talking about pandemic preparedness and response?
Okay, so with respect to pandemic preparedness and response, there is, of course, the issue of the vaccine, and WaterAid supports that there should be vaccine equity and everyone everywhere should be able to access vaccines as and when they need them. But I think at the same time, we should also be cognizant of the fact that, first of all, we've got healthcare workers, frontline healthcare workers, most of whom are women, who have to provide these services. What environment is it that they're delivering these services in? They need to be able to have a hand washing facility, alcohol-based drops that they can be able to wash their hands as they're treating or, examining their patients. They should be able to have adequate sanitation that is available within the environment that they're working in. So there should be toilets, they should have incinerators so that they can manage the medical waste. They should have a place where they can safely dispose of medical waste as they're doing their work. And also importantly, there has to be water available. And this water that is available has to be built, also being cognizant that as a world, we are also facing the climate crisis. So we want in every healthcare facility in the world, irrespective of where people are, has got these basics. Water is available that is relying on renewable energy, and that the governments are providing the necessary resources to make sure that those services are not just, there isn't just the capital investment that happens at the beginning, but that they are actually sustained over time. What we want to see is a cleaner in a healthcare facility, even in the remotest parts of the world, has got the mop, has got soap, has got a bucket, they've got gloves and other protective equipment for them to be able to do their job that they need to be able to clean the hospital environment so that themselves, the healthcare workers, and the patients are able to come in and get a good quality service. We've all seen how people stayed away from healthcare facilities during the pandemic for fear of being infected, and there's even research that has been done that showed that women, one of the things that women talk about in terms of the service that they want to find within the healthcare facility that needs to be improved is water, sanitation, and hygiene. So WaterAid is working towards having these solutions, and we've done a lot of programs within this space in countries like Tanzania, in Mali, in Malawi, in Nepal, in Zambia, where we are working with government to deliver workable and sustainable solutions within the healthcare space, so that within that space we have adequate water, sanitation, and hygiene. And we are calling on governments, we're calling on private sector, and even donors to meet the demand that is there, to meet the resource requirement to make sure that everyone has got access by 2030.
Okay, so it's all about sustainable solutions, irrespective of whichever country WaterAid focuses on. And in one or the other, you've talked about the things WaterAid does, and perhaps let's expound the conversation to analyzing some of the financial gaps that come with water, sanitation, and hygiene, and perhaps the opportunities that are usually there in terms of meeting this Sustainable Development Goal 6 that focuses on access to water and sanitation for all. Your final comment on that?
So the World Bank estimates that to be able to meet the SDG 6, the world needs to be investing at least $114 billion a year between now and 2030 to meet that target. Now, just to give an example of Africa, the current level of investment that is there in WASH will mean that by the time we reach 2030, we will be in the same position that we were before the SDGs started. And specifically to talk about, either hygiene or WASH in healthcare facilities. For everyone, everywhere in the world's 46 least developed countries, we need 19.1 billion to be invested over the next 10 years to reach universal access. Now, these may look like big figures when you look at them in themselves, but then when you consider the trillions of dollars that the world has lost in dealing with this current pandemic, when you consider that every year 77 million days are lost by women because of lack of, WASH services, either they are fetching water, either they're getting sick, loss of productive income that has a huge impact on economies. This is really a small price to pay for us to secure and make sure that we have a world that is safe for everyone and we are able to face pandemics. In fact, it's estimated, that for every dollar spent on water, sanitation, and hygiene, the return on investment is up to $21 up to 21 times the investment. So this is really a huge benefit to everyone, and there are trillions of dollars that can be unlocked in time saved, in reduced diseases, and can really improve even gender equality, because a lot of times what also happens is when there isn't enough water, sanitation, and hygiene, it's mostly women and girls who have to subsidize their time to be able to make sure that those services are available. And what does that do? It increases their risk of infection, it robs them of the chance to be productive, and all these are things that are not good for development everywhere. So we really need we really want governments to make the right investments, because this is a no regrets investment. It is an important investment that governments must make in the basics, so that we can stop spending all this money treating diseases like Ebola, like cholera, dysentery, typhoid, all of these, the huge burden of disease that Africa is facing right now. 50% of the health budgets countries are actually spent treating diseases that can be avoided by just investing in WASH. So the cost of it is a lot less than what we are paying right now to be able to treat, the results of not having water, sanitation, and hygiene.
Okay, well noted. At least intentional investment from various countries in order to achieve this basic right for each and every African citizen, and in the world in general, water, sanitation, and hygiene. Thank you so much, Annie Msosa, who's an advocacy advisor to Water Aid, who will be holding a side event during the Rwanda Global Healthcare Summit that will be focusing on health, water and sanitation, and hygiene as well in healthcare facilities, even as they expound on pandemic preparedness and response. Thanks for highlighting some of the key issues that will play out during this particular summit. Perhaps as we finalize, how exactly can one tune in if they want to participate in the virtual summit? Briefly.
So if you can go to the site for the Global Healthcare Summit, there should be information there in terms of how you can tune in. And then WaterAid will also be sharing a link via the WaterAid website.
Okay, thank you so much. Annie Msosa joining us from Lilongwe, Malawi, giving us at least a rough breakdown of what to expect during that particular Rwanda Global Healthcare Summit. We'll definitely keep you informed. Thank you so much for your contribution, Annie Msosa. Of course, so that's the latest that is set to happen between the 18th and the 20th of this month in Rwanda. But let's shift focus right now, perhaps closer home to the corridors of justice, where former Kiambu Governor Ferdinand Waitito has been